So good morning, good afternoon, good evening, wherever you're joining us from. My name is Milka Dinev. I'm the Regions Manager for the Reproductive Health Supplies Coalition, and I also backstop the Maternal Health Supplies Caucus. This webinar has been organized with UNFPA Supplies Partnership, and I'm privileged today to host these two wonderful presenters. We will have Emma Foster, a policy advisor in UNFPA's Family Planning Branch based in New York. And we also have Jessica Williamson, who is a research analyst at Avenir Health in the Monitoring and Evaluation and Advocacy Center. They will be presenting today on UNFPA Supplies Match Fund. Please keep your microphones off to avoid the noise from your offices or your homes. We will let the questions and answers for the end of the presentation. But please, if you have any questions, start writing them in the chat, and we will get to the chat and to your questions as soon as possible. This webinar is being recorded, and it will be made available in the RHSC YouTube channel in a couple of days. We will share the link for the recording. Do not hesitate to contact me or Laura Mayer if you have any problems during this transmission. Without further ado, let me introduce Emma. And I also wanted to mention that if you go to apps, je vais aussi vous avertir que si vous cliquez dans le icône de apps, vous pouvez trouver la traduction dans la langue que vous désirez. Si desean, ustedes pueden hacer clic en la función de apps. Tenemos un traductor inteligente en inteligencia artificial, así que por favor utilícenlo. Voy a volver a invitar a los usuarios. Invite users. See, invite users, all participants. OK. Alors, si vous préférez les français, vous pouvez cliquer dans la partie inférieure et mettre les apps. Dans les apps, vous pouvez trouver le Wordly traduction et vous pouvez choisir la langue de préférence. Ustedes pueden elegir el idioma de preferencia en la parte inferior de su pantalla, donde dice apps. Ahí tenemos la traducción a través de inteligencia artificial. Estoy compartiéndoles la invitación y pueden hacer clic en la inteligencia artificial. Si hubiera alguna pregunta, por favor, la ponen en el chat. Si vous avez des questions pour le fonctionnement de Wordly, veuillez le mettre dans le chat et je vais le adresser. Okay, now that we have done all the household arrangements, Emma, the microphone is yours. Thank you.
Fantastic. Thanks so much, Milka, for that introduction. And just let me start by saying that it's a real pleasure to be here with you all today. I think I speak on behalf of the entire team at UNFPA in saying that it's just so exciting to see so many participants joining us from across the world and for showing so much interest in our work at UNFPA on maternal health. So really thank you to all of you for giving us this opportunity. So in terms of today's agenda, First of all, we're going to start by setting the scene and providing you with some of the key background on UNFPA's wider mandate and work on maternal health. We're then going to really zoom in on the UNFPA Supplies Match Fund, and particularly focusing on how we're using this new financing mechanism to mobilize domestic resources for reproductive health commodities, and some of the key lessons learned, but also risks and opportunities that we see, particularly in the maternal health space. And finally, hopefully we're going to end with plenty of time for discussion and Q&A. And really that's our opportunity to hear from all of you on how we can better collaborate with the maternal health sector and really expand this work through the Match Fund going forward. So let's start with some key background. I'm now going to hand briefly to my colleague Jean-Pierre Monet, who is our technical specialist in our sexual and reproductive health branch at UNFPA, who's going to provide you with some of the key background on UNFPA's broader work and mandate in the area of maternal health. So over to you, Jean-Pierre.
Thank you, Emma. Good morning, good afternoon, everyone. So I'm delighted to give you a very brief overview of the work of UNFPA on maternal health. So ending preventable maternal death is one of the 3 transformative results of UNFPA by 2030. And our work on maternal and newborn health is guided by our maternal and newborn health and well-being strategy. That, of course, also contributes to the other 2 transformative results of UNFPA, which are ending unmet need for family planning and ending gender-based violence and all harmful practices. So we position our maternal newborn health work at UNFPA as part of a comprehensive package of sexual and reproductive health and rights interventions across the life course. So the MNH and well-being strategy has 3 pillars that you see here on the slides. And so briefly, the first pillar focuses really on the legal, financial, and policy environment for maternal and newborn health. So this includes interventions related to MNH norms, protocols, policy guidance, but also supporting work of inclusion of maternal and newborn health, and of course also the broader package of SRA in UHC benefit package in countries and advocacy for budget allocation to MNH. The pillar 2 focus on improving access to quality maternal and newborn health services, including in fragile and humanitarian settings. And then finally, the third pillar focus on addressing the social and gender norms impacting maternal and newborn health and well-being, but also supporting maternal and newborn health services in communities and the linkages with health facilities. So the work of UNFPA on MNH aligns and contributes to the global initiative called ENAP-EPMM, so Every Newborn Action Plan, Ending Preventable Maternal Mortality, which we co-chair with WHO and UNICEF. And it's an initiative that has set specific targets for supporting countries accelerate progress in maternal and newborn health by 2030. We work, of course, with many partners. Many of them are in this call, but we wanted to highlight that we are launching a collaboration with UNICEF to improve access to life-saving commodities to prevent and treat postpartum hemorrhage. On the next slide, please. Thank you. So the Maternal and Newborn Health Thematic Fund is UNFPA's flagship thematic fund dedicated to maternal and newborn health, and it's basically the main driver for supporting the implementation of the strategy in collaboration with UNFPA Supplies Partnership and other UNFPA programs. It focused, so this fund was created in 2008. It focused on 32 countries, but now with the new phase 4, it expands its support to 44 countries. And it, of course, supports the 3 pillars of the strategy that I mentioned previously, focusing on the 6 outcomes that are described here on the slide. And so briefly, you see that among these outcomes, you have the second one supporting to improve quality and experience of MNH care in health facilities. The third one really focused on strengthening the midwifery workforce, including the status, the regulation, the education and the deployment of midwives as key providers for SRHR services. The fourth one, I think very high interest for this webinar is to support access to quality assured MNH commodities, with here a particular focus on updating national essential MNH medicine and protocols, and also training health providers. And then finally, we have the sixth one, which is that I wanted to highlight, which is a cross-cutting one on data, where we support strengthening health information system, for example, on monitoring stockouts of essential medicine. So I will stop here with this very brief overview, and Emma, so I hand it over to you, and I will be happy to answer any question. Thank you.
Great, thanks so much, Jean-Pierre. So now moving on to the UNFPA Supplies Match Fund, which is really the focus of today's webinar. Perhaps before we dive into some of the details on this new fund, we wanted to provide you with some key background on the UNFPA Supplies Partnership, for those of you that might not be familiar with this program. So let's start with the basics. UNFPA Supplies is essentially our flagship thematic fund at UNFPA that is dedicated to expanding access to contraceptives and maternal health medicines. So the program currently procures the full range of contraceptives, as well as 6 life-saving maternal health medicines, which are oxytocin, misoprostol, calcium gluconate, tranexamic acid, and heat-stable carbetocin. The program currently operates in 54 countries, predominantly in sub-Saharan Africa, but also in Asia, the Pacific, and Latin America. In terms of how we work through this program, our operating model is pretty simple. We essentially procure commodities on behalf of governments, and we then work with our government counterparts and NGOs on the ground to strengthen health systems and to ensure that those supplies actually reach the last mile. Why do we do what we do? Well, our overarching mission through the supplies program is really to deliver a world where everyone can access quality reproductive health supplies wherever and whenever they want or need them. So that's just some key background on the UNFPA Supplies Partnership. We also just quickly wanted to show you the full list of the 54 countries where the program currently operates. It's worth noting here that these countries have been selected because of their low GNI per capita, their high rates of maternal mortality, and their low rates of maternal contraceptive prevalence. So essentially, these are the countries that are assessed to have the greatest needs when it comes to sexual and reproductive health supplies and services. Now, in 2021, we launched what we call phase 3 of the UNFPA Supplies Partnership. And under phase 3, we've really sharpened our focus on sustainable financing and launched a number of new initiatives that really aim to support governments to increase domestic resources for quality assured reproductive health commodities. So here you can see some of the different components of what we call our domestic financing toolkit under the UNFPA Supplies Partnership. So these are essentially just some of the new financing mechanisms that we've launched in recent years that really aim to support governments to mobilize domestic resources for reproductive health commodities. Today, we're going to be focusing in on the Match Fund, which is, as you can see, the second component of our domestic financing toolkit. But really, we just wanted to highlight here that the Match Fund really represents just one tool among many, and by no means represents the totality of our work on domestic resource mobilization. So now delving into the Match Fund, let's talk about some of the specifics. So the Match Fund is a new innovative financing mechanism that we launched back in 2022 that enables UNFPA to match government contributions for quality assured reproductive health commodities. So that includes contraceptives and maternal health medicines. The overall goal of the Match Fund is really to support governments to increase domestic resources for quality assured reproductive health commodities. By domestic resources, I should clarify that really here we're referring to government contributions that have either been sourced from public funds or concessional financing. So we're excluding government contributions that have been sourced from donor resources. Importantly, the Match Fund can also incentivize governments to share their expenditure data and to procure quality assured commodities. So essentially, in order to access the Match Fund, governments need to provide us at UNFPA with evidence that they have procured reproductive health commodities using domestic resources. So we need to see proof of expenditure. And they need to provide us with evidence that those products are quality assured. So the Match Fund can really provide us with much greater visibility into what governments are actually buying using domestic resources when it comes to reproductive health commodities, and potentially also help to incentivize a shift from non-quality assured to quality assured products. And we know that that is particularly relevant in the maternal health commodity space. So now in terms of the country allocations for the Match Fund, so currently all 54 of our program countries are eligible to access the Match Fund this year and next year in 2025. In each of these countries, UNFPA can match government contributions for quality assured commodities on a 2-to-1 basis, up to a maximum budget ceiling of $2 million per year. So essentially what that means is that for every dollar that is contributed by the government towards quality assured reproductive health commodities, UNFPA can provide $2 worth of commodities through the Match Fund. And we'll talk a little bit later on about how that process actually works. So moving on now to some of the main eligibility requirements. So in order to access the Match Fund, governments need to meet 3 main eligibility requirements. The first is that governments will need to demonstrate that their total expenditure on reproductive health commodities has either increased or remained constant since the previous year. Secondly, governments will need to provide us with evidence that those products are quality assured. And by quality assured, really what we're referring to here is we need to see proof that the products are either WHO Prequalified or approved by a stringent regulatory authority. Now, of course, if the government has bought those products through UNFPA, then we already know that those supplies meet our quality assurance requirements. But if the government has placed an order directly with a supplier, then we ask them to submit the necessary documentation so that we can verify the quality assurance standards. And finally, we need to see evidence that the government's total expenditure on reproductive health commodities either meets or exceeds what we call the program's minimum domestic financing requirement. So starting from last year, 2023, all governments, unless they were, of course, granted an exemption, were required to make a minimum contribution towards the cost of program-funded commodities. And that minimum contribution starts off very small, between 1 to 10% of the value of supplies provided through the program. And that depends on each country's economic grouping within the partnership. But really importantly, we can only match government contributions that either meet or exceed that minimum domestic financing requirement. So we now wanted to move on to some tangible examples of the Match Fund in action, and to walk you through some of our front-runner countries, if you like, that have already accessed the Match Fund and made use of this financing mechanism. So for this section, I'm going to hand over to my colleague, Jessica Williamson from Avenir Health, who's been leading so much of our work on expenditure tracking and has really been at the heart of the design and implementation process for the Match Fund. So Jessica, over to you for these slides.
Great, thanks, Emma. And thank you everybody for the opportunity to talk about this really exciting work and demonstrate the potential value for this community. So what we wanted to do is give an example of how the Match Fund is working kind of in practice and action. So this is the process that was taken for the government of Malawi to apply for and then be approved for match funding last year. In 2023, the government of Malawi placed an order through UNFPA Supplies for contraceptives and maternal health medicines. Many of our orders are placed through UNFPA Supplies, but we also have orders that are placed, the domestic government kind of doing their own procurement, independent procurement. So any of those is eligible, but the process varies slightly depending on the supplier of the products. So the government of Malawi placed their order through UNFPA Supplies. Based on that order, the country office worked with colleagues at the Ministry of Health to submit an application for the match fund. The application documented that 2023 order represented an increase in domestic spending over the prior year. As Emma mentioned, that's one of the eligibility requirements. Documentation of the value of the expenditure, so essentially receipts for that purchase, and a list of the specific commodities procured was submitted along with the application. And these were reviewed to ensure both that the commodities were eligible for matching funds and to validate that specific expenditure, the cost of the commodities. Since this purchase was made through the supplies program, there was no further review needed to ensure that the products met quality assurance standards. However, in cases where procurement is done outside of the supplies program, documentation of the quality status of the products is required. So that might be something like a declaration of conformity to be submitted and reviewed as part of the application. So based on a review of the documentation that was provided, Malawi's expenditure was assessed as eligible for match funding. Their application was approved, and an additional $431,000 worth of commodities were allocated to Malawi through UNFPA Supplies. An important note here, and we just really wanted to flag this for clarity, is that for all countries applying to and qualifying for match funding, the match funding award comes in the form of additional commodity allocations from the supplies program. So this usually takes the form of contraceptives, although that's kind of a negotiation and up to the supplies program and the country office in terms of what commodities they're seeking. So it's not a direct cash transfer. It's always in the form of donated of commodities through the supplies program. So, oops, sorry. There we go. So as Emma mentioned, the match fund was launched in 2022. What you can see here, this graph is showing a rolling total of the funds that have been awarded since our first application from Zimbabwe was approved in July of 2022. So as you can see from this trend, I'm a data geek, so I love trend graphs. But as you can see from this trend, the program was relatively slow to start. We had just a few applications in the first year. And this was in part due to some challenges in communicating this new program and some confusions about eligibility, which we think limited early participation. We've made substantial efforts across the program to simplify our message. Emma, I think, gave a really clear, concise summary of how countries are eligible and how much they're eligible for. And there were also substantial efforts to socialize the program across the supplies countries and really, kind of share information. Those efforts really began to take effect in 2023. You can kind of see we have this big, rapid increase in disbursements, in awards, kind of in the middle of the year and towards the end of the year in 2023. So despite that slow start, the program really has gained significant traction and is seeing expanding participation across the UNFPA Supplies Partnership. And what you'll see here are all of the countries that have accessed the match fund since its launch in 2022. As of February 2024, with some applications just approved this past week, 21 of the 54 supplies countries have been awarded match funding, including some repeat participants. So we've had a couple of countries that have come back based on expenditures in 2022 and expenditures in 2023 to access the match fund. In total, almost $22 million in match funding has been awarded in the form of additional commodity allocations. And we estimate that the availability of match funding and this program has helped to leverage more than $15 million in domestic resources for the purchase of quality assured family planning and reproductive health commodities. So as you can see from the map, we've had participation from a wide array of countries with very different fiscal environments, including some really exciting examples of domestic resource mobilization. There were some countries that that were really surprises for us. So some examples of just a few of the key examples that we talk about a lot when we talk about the match fund. The first being Zimbabwe. So we've seen some really positive developments in Zimbabwe through the match fund. Like I said, they were the first country to apply and receive funding, and also the first to return with a second application. So they accessed the match fund 2 years in a row. on the basis of increasing domestic expenditures towards national procurement of contraceptives. So really exciting to see not just, kind of 1 year, but kind of developing a pattern of procurement and relatively large expenditure on procurement. There was a substantial effort made by the government of Papua New Guinea to mobilize a very small but meaningful first expenditure for contraceptives and reproductive health supplies in 2022, which was then followed the subsequent year by a much larger expenditure, both of which resulted in match funding. So we're seeing kind of progressive participation, countries starting small and scaling up. And then we've also seen a few first-time contributions from domestic governments. Surprising and exciting for us was that the government of Yemen substantially exceeded their compact commitment in 2023 and leveraged domestic funds along with the match fund to start to try and address a substantial funding gap that they saw in 2023 for reproductive health commodities. So on this map, what you can see and kind of moving into the, kind of the bulk of what we wanted to talk about today, is that most countries are accessing the match fund on the basis of expenditures on contraceptives alone, but we have had several examples of countries including expenditures on maternal health medicines in their match fund applications and receiving match funding, not just on the basis of contraceptive procurement, but also maternal health medicines. So we'll jump and see, kind of in more detail which countries those were. So Niger, which was actually one of our most recent awards, Chad, DRC, which was one of our earliest awards, Malawi, Timor-Leste, and Papua New Guinea, who I mentioned before. So all of these countries have accessed the match fund based on expenditures that included both contraceptives and maternal health medicines. As Emma mentioned earlier, the match fund can be accessed on the basis of expenditures from public funds or concessional financing. So of the 6 countries here, 2 used concessional financing. I think it was mostly funding from the World Bank. And then the rest used public funds in order to procure commodities and qualify for the match fund. So between those 6 countries, we've awarded around 7.3 million, and that's for kind of the entirety of their expenditures on contraceptives and maternal health medicines. So then getting into a little bit more detail, Emma had mentioned that there are 6 maternal health medicines that are eligible for matching through the supplies fund. Those are listed here. So oxytocin, magnesium sulfate, calcium gluconate, misoprostol, and then heat-stable carbetocin and tranexamic acid. This list doesn't represent all maternal health medicines that are being procured by these domestic governments, but is a demonstration that these are the products that have been included in match fund applications to date. 5 of the 6 countries procured oxytocin and or magnesium sulfate. Those are most commonly the products that were procured, and most countries, again, it's a pretty limited list, so we don't have a ton to pull from, but most countries procured multiple medicines, at least 3 different medicines. Of note, the last 2 medicines that are included on this list were newly introduced products to the UNFPA catalog as of 2021, so the heat-stable carbetocin and tranexamic acid. And we also wanted to flag that UNFPA Supplies is supporting countries separately, like outside of the match fund program, for the procurement of these 2 commodities through a separate new and lesser used commodity fund. If there are specific questions about that, my colleague Agnes is on the line and can talk more about the potential for those, but supplies programs can potentially access these commodities through that fund. So I'm going to pass it back to Emma to talk a little bit about our lessons learned and some of the some of what we're hoping to explore in terms of the match fund and its role in maternal health medicines.
Great. Thanks so much, Jessica, for that overview. That was fantastic. So, since the launch of the Match Fund in 2022, we've learned so many lessons related to domestic resource mobilization, and we're gradually starting to build a much clearer picture of what works and what doesn't work when it comes to domestic financing. So here we've captured just some of the key themes, if you like, as to where we see the greatest challenges and opportunities. And much of this feedback really comes from our in-country stakeholders, so government counterparts, our colleagues, of course, across the UNFPA country offices, and our NGO partners on the ground that we speak to regularly. So we just wanted to bring out some of the key themes. The first really relates to budget execution. So, we often hear from our government counterparts and partners at country level that budget execution is one of the biggest challenges we face when it comes to domestic resource mobilization. So we often see governments making very ambitious commitments to the domestic financing of reproductive health commodities, successfully allocating a budget line for those commodities, but then simply not being able to execute those allocated resources before the end of the fiscal year. Now, in some cases, that might be due to competing political priorities, which means that resources are reallocated or diverted away from reproductive health commodities. But in others, it's simply due to perhaps administrative bottlenecks or delays to the procurement process. So really much more technical working level issues that can be more easily resolved. And so really this learning for us just reinforces the need for us as a sector to focus really on that final stage of the budget cycle to ensure that allocated funds are actually being spent before the end of the fiscal year. Secondly, on fiscal constraints, unsurprisingly, we know that many of our countries are facing an extremely constrained fiscal environment. In some countries, rising levels of debt distress. And so that has, of course, created major challenges for our work on domestic resource mobilization by increasing the competition both within and across sectors. And so I think really this learning points to the need for us to be very realistic in our goals around domestic financing. In many countries, we've really focused on just starting small, supporting the government to create a budget line for commodities and to execute that budget line, even if that expenditure represents 1% of the total value of demand nationally. We still see that as an important first step towards sustainability and increased government ownership and accountability. So we need to make sure that we're realistic and, of course, that we're not creating or exacerbating financial shocks in our partner countries. Third, around quality assurance, something that we've learned through the Match Fund process is that, unfortunately, often quality is missing, very often from the conversation around domestic resource mobilization. So we have had instances where governments have procured reproductive health commodities, but they've been unable to access the Match Fund because those products were not quality assured. So they were either not WHO Prequalified or approved by a stringent regulatory authority. So we really need to make sure as a sector that quality is front and center of our advocacy messaging when it comes to domestic resource mobilization. Because, ultimately, if governments are spending more of their own domestic resources on reproductive health commodities, but they're buying products that are of substandard quality, then we haven't succeeded in our work on domestic financing. And finally, subnational engagement. So in many of our program countries, we learned that engagement at subnational level was really critical to success. So it's really important that, again, in our advocacy efforts around domestic resource mobilization, we're not only focusing on the federal or central government, but also local actors at state or provincial levels. So now on to the opportunities and challenges that we really see for Match Fund implementation, specifically in the area of maternal health. So first and foremost, we really believe that the Match Fund can be a game changer in supporting governments to increase domestic financing for maternal health medicines and to ultimately, fill or lessen funding gaps that we see across our partner countries. So we've already seen 6 countries taking up this opportunity. And of course, we hope to see many more over the coming years. Of course, the associated challenge with that is that we know that the financing landscape for maternal health medicines does look quite different to that of contraceptives. We know, of course, that in many of the countries where we're working, governments are already funding a high proportion of their maternal health medicines, whereas we do typically see much greater donor dependency in the family planning space. So we need to be really careful that we're not creating perverse incentives and using the match fund to substitute domestic resources for maternal health medicine. So this is a risk that we're very carefully monitoring, and again points to the need for us to really tailor our advocacy efforts according to the country context. Secondly, on product quality, so we believe that in some countries, the match fund can provide a really important financial incentive for governments to switch from non-quality assured to quality assured commodities by offsetting any potential price difference. Of course, the associated challenge with that is we know that in some countries that financial incentive simply won't be enough. We know, having spoken to many government counterparts, for example, that some governments will still prefer to procure products that are not WHO Prequalified or SRA approved, perhaps because they would like to procure locally, or because they want to rely solely on national regulatory bodies. So that is a challenge that we really need to address in terms of our advocacy efforts. The third opportunity that we really see in the maternal health space relates to data transparency. So one of the things that we're really excited about is that the Match Fund is providing us, in many cases, with first time and unprecedented access to government expenditure data. And so we're really seeing this as a tool to improve data quality and visibility. Of course, at the same time, we need to be cognizant of the fact that often the data sources, the reporting mechanisms, and the procurement processes might be different for maternal health medicines versus contraceptives, which can make data tracking and reporting quite difficult if we're looking to take an integrated approach. And finally, we see the Match Fund as a real opportunity to strengthen integrated advocacy efforts and planning processes. So really bringing together our efforts on family planning and maternal health financing. Of course, one of the challenges when it comes to that kind of integration is that in some countries, there might actually be good reasons why our advocacy efforts need to be kept separate, right? Perhaps the challenges that we face in the maternal health financing space are very different to that of family planning. Perhaps we need to work with different government departments, so the audiences will be different. But I think all of this really, again, just reinforces the need for us to base our advocacy messaging on the country context and to ensure that we are tailoring our messages based on the unique financing landscape across these two commodity areas. So we just wanted to provide you with some sort of high-level reflections, if you like, on the key challenges and opportunities that we see specifically for the Match Fund in the maternal health space. That marks the end of our presentation. I think now we will hand back to you, Milka, if that's okay, to guide us through the discussion and the Q&A session. I think we'd be really keen to hear from all of you on your, of course, immediate reactions to this work, but also your ideas and perspectives on how we can strengthen collaboration with the maternal health sector. So thanks very much for the opportunity again, and back to you, Milka.
Thank you so much, Emma and Jessica. Thank you so much, Jean-Pierre, for the introduction. It's been fascinating to listen to all of you. And our chat has been flowing with discussions. So I have a first question here. Lots of people have been using artificial intelligence to take notes. That's good. All right. The first question. Do you start writing? It takes me back down. I'm sorry. Okay. Martha Brady, fiscal constraints and competitions with other health areas and sectors is a major challenging. Sarah Jones, can countries receive both Match Fund commodities and the free commodities through UNFPA to booster overall supply? What do you say?
Fantastic. Thanks so much. Well, perhaps I can take the second question relating to commodities first, because that's an easy one. So the answer is yes. So our program countries will also have access to what we call the routine commodities allocations. And also, as Jessica mentioned earlier, to an additional financing stream that supports the procurement of new and lesser used products. So in the area of maternal health, for example, that would cover tranexamic acid and heat stable carbetocin. So really the match fund serves as an additional top up to the commodity allocations that our program countries are already receiving through the supplies partnership. So hopefully that answers your question.
Did you want to touch on the minimum financing requirement there, because they were framed as free commodities from the supplies program, and I don't know if it would be helpful to also touch on the minimum domestic contribution.
Yeah, thanks, Jessica. I didn't see that in the question, but yeah, definitely. I think that's all very relevant. So as I mentioned earlier, starting from 2023. Sorry, Milka. So starting from 2023, the UNFPA supplies program moved from a model of product donation to one of product subsidization. And essentially what that meant in practice is that all of our partner governments were required to make a minimum domestic financing contribution towards the cost of program funded commodities. That contribution was relatively small. It ranged between 1 to 10% of the total value of supplies provided through the supplies partnership. But really the goal here was to ensure that we could institutionalize a new way of working between UNFPA and governments and slowly build the capacity and government ownership to ensure that all of our program countries are able to strengthen domestic financing for commodities over time. So first of all, we need to see evidence that governments have met that minimum domestic financing requirement. And that is a contribution towards what we call the routine commodities that are provided through the supplies partnership. Once we have evidence of that, then governments can apply for match funding. Also worth noting that new and less used product fund that I just described, that is again an additional funding opportunity, so is separate to the domestic financing requirement, which all countries are required to meet as of 2023.
Okay, I see in the chat that some of the questions have been answered by Agnes. Thank you so much, Agnes. There's another question here from Sarah Webb. Have you been able to glean any best practices with regards to domestic resource mobilization, particularly looking at how governments are increasing financial contributions? That is, whether that has been via cost shifting to end users, integration into universal health coverage, or other insurance models?
Yeah, thank you so much. It's a great question. And it's one that I think, I could talk about all day for hours. I mean, we have done quite a few reviews of the Match Fund and of our co-financing initiatives. Be really happy to share some of those reports with participants if they'd be interested in some more tangible examples of best practice at country level. But perhaps I can just provide some high-level reflections and observations. I mean, I think one thing that has been really, really critical to success on domestic financing, particularly in the reproductive health commodity space, is alignment among donors and partners. So, unlike vaccines or, antiretrovirals and other commodity areas, we know that when it comes to the reproductive health commodity markets, it's a very fragmented space. And in many countries, we have several large donors, bilateral as well as our multilateral partners, that are providing reproductive health commodities through separate channels. And so, it's really in countries like Madagascar, like Zimbabwe, like Kenya, where we've seen all of the key donors and the NGO community coming together around a single vision and a single advocacy message around domestic financing, we've really seen the most progress. In terms of integration into national health insurance schemes, we've certainly seen some great successes there, including in Ghana, and I know that there's a huge amount of work also taking place in Kenya now to really integrate family planning into the health insurance scheme and also to take a sort of more total market approach. So we definitely see that as a huge opportunity over the coming years.
We have a question from Saunia Ramarao. What are you seeing regarding the implications of limiting generic manufacturer participation in the commodity space? Is there any assistance being provided to generics to get to PQ or SRA qualification? Limiting generics in participation limits competition in the market. I see that
Thanks so much for the
Agnes,
question.
yeah, Agnes has also responded there. Okay.
Yeah, Agnes, I think you're best placed to answer that one.
Sure, I had responded to it. Milka, do you want me to speak to it now again?
Well, yes, we encourage
Sure.
generic manufacturers. Yeah, sure.
Yeah. So we do encourage our procurement to prioritize generics. We do have limited availability of generic manufacturers in some product categories. However, there are quite a number of partners, WHO included, working with generic manufacturers to support them to go through pre-qualification. Unfortunately, it's an area that takes quite a lot of time in terms of getting manufacturers to that level because of, in some cases, the technology transfer that needs to be done, but also the capacity of the manufacturers to reach that level. But work is in progress in all product categories to ensure that we do have some generic manufacturers available.
And Debbie Armbruster is asking, is there any opportunity to include essential medicines for newborns, that is gentamicin or amoxicillin? And I think she means under the UNFPA Supplies Partnership Program and the Match Fund. Because there were only 6 medicines, which are the maternal health, but she's talking about newborns.
Sure. So the UNFPA Supplies Partnership Program, it's a thematic trust fund that is focusing on family planning and reducing maternal mortality. So at the moment, that's the focus of the products that we procure. We have not ventured yet to include a newborn and neonatal, mainly because of budget constraints. Currently, we are not even meeting some of the needs from countries for the contraceptives and maternal health medicines. So at the moment, the focus is on family planning and maternal health, the 6 maternal health medicines that Emma and Jessica talked about the last few minutes.
And we have,
go ahead.
Sorry.
Oh,
No,
I was
no,
going
no,
to say that
Jessica.
in the chat, there had also been a number of questions about the potential for adding additional maternal health medicines to that list. And I wanted to see if I know you'd responded in the chat, but if you didn't mind speaking to that a little bit for everybody to hear.
Yeah, so again, the focus has been to reduce preventable postpartum hemorrhage. And those 6 products were initially, they've expanded now to 6, but initially the early ones came from the UN Commission of Life-Saving Commodities. And that's how we came about with the list. So at the moment, it's those 6 with the intention, as Emma has alluded to, that we have other partners and the governments themselves also contributing to the other medicines that we might not be able to support at the moment.
Right. There's a comment from one of our co-chairs of the Advocacy and Accountability Working Group, Dr. Habib Salami, and he's saying that program managers in country have very poor knowledge of the country's budgeting process, which contributes to the poor budget execution. The belief is that once the money is budgeted, the funds are budgeted, then it automatically goes through allocation and disbursement, which is not always the case. I see that Agnes has responded to others. The history of family planning over the 50+ years, and this is Martha Brady, was primarily via donor procured supplied contraceptives to low and middle income countries. So many governments did not need to finance these supplies. Many changes are underway, correct? Local manufacturer, and Agnes has responded that. People are saying that the presentations were excellent. We have Nama Cancun saying, one significant obstacle that countries and states encounter in procuring SRA WHPQ commodities is the cost, and could explain why few countries have accessed maternal health products compared to family planning. Exploring alternative options, such as supporting states willing to distribute funds through sustainable financing platforms like drugs revolving funds, could prove beneficial. Yeah, and we've seen that local procurement of maternal commodities sometimes is quite low cost, but quality is not assured, and that has been one of the priorities of the caucus, ensuring that governments procure quality commodities. Jeff Jacobs from Merck for Mothers. He's grateful for your insightful presentation. Our practical experience is that, is that UNFPA country offices could use a refresher on what is and is not eligible for procurement. Often there is a lack of awareness of the ability to procure maternal health commodities, thinking that only family planning commodities are the only eligible commodities. And I'll make a public service announcement here. We've been seeing this in our Catalytic Opportunity Fund for new and lesser used commodities, where local organizations are unable to find the commodities because the governments don't know they can access this matching fund. And so maybe the country offices would need a copy of the presentation. Robin Churchill from USA. Has there been any analysis of cost of non-quality assured products versus the cost of the same products with this 2-to-1 match program? In other words, is there a cost to doing this, or is it cost neutral? Jessica?
Yeah, so I'll just jump in quickly that that most of the data that we have on the product costing is based on quality assured products, because we aren't accepting applications. We did have one application for the match fund that was based on non-quality assured products, but just given the and Emma and Agnes can speak further to this, but kind of given the structure, we didn't, the focus is on encouraging the procurement of quality assured products. So we are collecting data, or we're attempting to collect data on the cost of the quality assured products that are being matched. And a lot of those are being procured through the supplies program and through specifically the third-party procurement. And so there we have transparency on the costs that are being the cost per product, but we haven't been collecting data for those for any non-quality assured products. And I don't know, Emma, if you wanted to talk any more about that. There are a lot of questions I know in the chat about kind of the quality assurance requirement. So.
Yeah, thanks so much, Jessica. I mean, yeah, as Jessica said, I'm not aware of any detailed analysis that we've done to compare the price difference between non-quality assured and quality assured maternal health medicines, but certainly anecdotally, based on the government counterparts that we are speaking to as part of the Match Fund application process, our assumption is that the Match Fund, particularly on a 2-to-1 basis, would be offsetting any potential price difference between the non-quality assured versus quality assured product. And like I said earlier, we also need to be cognizant of the fact that the barrier to governments procuring the quality assured products it is not always financial, right? We know that there might be other factors at play, perhaps a preference for governments to be procuring locally, or perhaps a preference for governments to be relying on national regulatory bodies as opposed to procuring products that are WHO Prequalified or SRA-approved. So I think we have to be aware of the many different factors that are at play and the incentives that are at play as governments make their procurement decisions on in the maternal health space. Perhaps just to respond to some of the other comments, Habib, I completely agree with you that we continue to see this challenge time and time again around budget execution, and you've been doing some amazing work through the smart advocacy workshops at country level to ensure that we're raising awareness and knowledge about the different stages of the budget cycle and engaging with the right decision makers to ensure that allocated budgets are actually spent on time. And I think it's been a lesson for all of us within the sector that perhaps historically we have focused disproportionately on the commitment making process, right? We are very good at celebrating success when a government makes a really ambitious commitment to reproductive health commodities. We then celebrate again when we hear the budget has been allocated, but we really, really need to sharpen our focus on expenditure tracking to ensure that we're focusing on that final stage of the budget cycle, and we're ensuring that funds are spent before the end of the fiscal year. Because like I said, so often, it's tragic when we speak to some in-country partners to learn that, perhaps resources have been reallocated or diverted simply because of procurement delays or because of an administrative bottleneck, perhaps getting a signature on a contract. So often, we are looking at technical working level issues and bottlenecks that can be relatively easily resolved if we just sharpen our focus on that final stage of the budget cycle.
We have reached the hour, but we have one question that came yesterday from Ashif that saying, is the UNFPA Supplies Match Fund different from a compact?
The answer is yes, but both the compact and the match fund are sort of two key components of that domestic financing toolkit that I presented earlier on. So the compact essentially is a new agreement that is signed between the Minister of Health, the Minister of Finance, and UNFPA in all of our partner countries, and that outlines the government's commitment to domestic financing. And really importantly, the government's commitment to meet our minimum domestic financing requirement that was operationalized last year. The Match Fund really serves as an incentive for governments to exceed that minimum requirement. So we hope to see Match Fund contributions integrated into those compact agreements. We are already seeing that in many of our partnership countries. But essentially, the compact is a requirement. The Match Fund is an additional incentive mechanism. That's, I think, how I describe it.
So we have come to the end of the webinar. I'm so sorry we cannot entertain more questions, but we have recorded this webinar. It will be made available to all of you, as well as the presentation. You can take this presentation and share it with some of your colleagues. Plus, this webinar will be in the library of webinars that the RHSC maintains in its website. Thank you again, Emma Foster, Jessica Williamson, for this wonderful presentation. I also want to thank Jean-Pierre and Agnes for making yourselves available today. And thank you all for this wonderful webinar. We have had almost 80 participants at the moment. So it's wonderful that a lot of people are interested in availability of maternal health commodities. Stay tuned to more activities organized by the Maternal Health Supplies Caucus. And I want to really thank one of our co-chairs, Siobhan Perkins, for helping us facilitate the organization of this webinar. Thank you, Emma, again. Thank you, Jessica. In the name of all the participants, it was a superb presentation. Thanks, and we hope to have you again soon. Have a great rest of the day and good evening for those of you on the other side of the world. Thank you. Bye-bye.
Thanks so much, everyone. Really appreciate this opportunity.
Thank you, Emma.